This is a Capricorn FM podcast.
On the Call Breakfast on Capricorn FM, Limpopo's higher frequency. It's 7:45. We promised you an interview right now. So we are talking to a campaign that aims to equip young people in Limpopo to spread the right information about COVID-19.
Oh, yes. You know, we've had so many conversations around COVID-19, the numbers and the information, all of those things. But one thing we agree on is how important it is for communities to be thoroughly educated about COVID-19, you know, as more information and more different information becomes available. But what if you could mobilize young people in communities to do exactly that while giving them an opportunity to also earn an income? Well, the campaign 750AMPED aims to do just that. This campaign is heading to the province and they want young people to somehow get involved. We are talking to the CEO of Pax Africana Holdings and also someone who's part of 750AMPED campaign, Mr. Murendeni Nefale. Good morning. Welcome to the show. How are you this morning?
Good morning. I'm doing well, thank you. Thank you for this opportunity to be with you guys on the show.
Thank you so much for making the time to also talk to us. All right, let's get straight into it. 750AMPED, give us a brief summary of what exactly that campaign is about.
Yes, so 750AMPED is an initiative, as you guys have rightly said, that is using the power, and we're saying we're leveraging the power of youth during times of crisis. And the idea behind the campaign is to educate. One of the biggest things, one of the biggest and yet one of the smallest things that we can do is have the right information during times like these, during times where we're dealing with this virus which we don't know much about. At this stage, it's been around for some months, and we've been able to gather some information, but it's an ongoing pandemic, it's an ongoing virus. So the WHO earlier this week were talking about new information, new evidence that they're receiving that seem to speak to another component of how the virus operates. And so we decided to put together this campaign that goes around the country, and we have identified, we had initially through the approach as we started this project, we had identified some of the communities that had the highest infection potential, the places and the communities that were mostly dense and mostly populated, and we identified a group of youth in those communities. We sent out young people in the respective communities, so we didn't bring people from outside. We went through a strict vetting process to ensure that we're using youth from those communities, sure, because they are the kids who live there. They are the kids who have the passion and the desire and the love for those communities. And so as they go out, the idea is they will go out and inform the communities about this virus. And so even in the name itself, 750AMPED, each of the numbers symbolize something. We say we're fighting the coronavirus 7 days of the week, utilizing the 5 major preventative measures, which will ultimately lead us towards a journey of zero infection.
Nice.
Very, very, very nice. Now, indeed, we must use the youth in communicating very important messages during a crisis like this. But this cannot go without attitudes and behavior from the youth. What are your observations so far?
Yes, you know, one of the things that we felt was important in this campaign is this issue of attitudes and behaviors. What are the misconceptions about the virus? And so we saw early on when the virus first started to hit the country around March, April. A lot of people were still in denial. A lot of people were saying this thing is it doesn't exist. This thing is made up.
Sure.
And as our young people have been going out into the community, they have gotten a mixed bag of results. Some people believe what the virus is. They ask more questions, and some people are like, no, I don't want to talk to you. I don't have anything to talk about because you don't have anything to tell me. So over the months, I think, unfortunately, as more deaths increase, as more infections increase, as more people are in contact with people who know somebody who was affected by the virus, it's starting to become more real. And so that's what we're trying to do with the initiative. We're trying to highlight what we can do as communities, what we can do as individuals to prevent ourselves from getting infected by the virus, but more importantly, from infecting our loved ones. So a lot of young people, especially, the science is telling us more older people are getting affected, more older people are at risk. But as a young person, as young people, we need to remember the importance of the fact that if I get infected and it doesn't affect me, my body can deal with it, but my loved ones may be affected. And so we're trying to spread accurate information. We're trying to empower our people with the right kind of information so that they themselves can protect themselves and other people and the other people around them.
So here's the thing, right, about trying to make sure you're educating people around spreading the right information. Information around COVID-19, we keep on getting new information, new developments. And sometimes these new pieces of information, something gets retracted and then we have to rethink how that information is. And then you have young people, right, that are going into communities to educate. Sometimes people look at young people on some, can we trust what they have to say? What do they know? You know what I'm saying? So how do you help young people separate true information from misinformation or fake news?
Yes, that's such a good question. It is such a valid point. Because even as we were conceptualizing this idea of using young people, we knew that there would be the potential risk of people in the community saying, but what do you guys know? And so we went about a rigorous process of training our young people. So first of all, before even training our young people, we spent some time with some specialists and some experts in the medical field, in communicable diseases, to help us create curriculum and content that we could then curate and teach our young people and empower them through that. So all our young people in the program, they go through, the program is a 6-month program. So even during the entire duration of the program, while our young people are going out into the communities, they're actually learning the entire time. So that because we're partnering with the Health and Welfare CETA, one of the partnership components allows us then to empower young people by training and by education. And so we actually go through a process where we give them access to courses online, where even before they go out into the community, they have to go through training, understanding the virus, understanding how it operates, understanding the implications. And through that course then, as we get more information, we are updating and adapting the content to the information that we're receiving. So our young people are actually very equipped and well knowledgeable. And they're not just speaking information that they're getting online. No, they're speaking information and they're communicating information which they have been trained, which has been curated by medical experts. And I mean medical experts as far as you can define them as medical experts, because we know medical experts disagree, even in the things that they're saying about the virus. But we've been able to use some recognizable authorities. So in South Africa, the NICD, the Department of Health, and then we utilize information from the World Health Organization as well, and combine that to empower our young people to go out.
Thank you for joining us this morning, Murad.
And that was Murendeni Nefale, CEO of Pax Africana Holdings. He's also a part of 750AMPED campaign. Go to check them out on social media and find out when exactly they're going to be in Limpopo.
That was a Capricorn FM podcast. For more podcasts, visit capricornfm.co.za.